Dear Presiding Officer, what step is the Welsh Government taking to ensure equality of access to healthcare provision?
Thank the member for that question. The Welsh Government works directly alongside those with lived experience of health inequalities to improve access to healthcare provision. That work is embedded, for example, in the Anti-Racism Wales Action Plan and in the advice of the Disability Rights Task Force.
Thank you for your response, First Minister, but the truth is that we are failing in our equalities duties when it comes to health care. In the past week, we have had a report from the cross-party group on cancer, backed up by evidence from Cancer Research and Tinovus, which highlights the experience of the BMA community in accessing care. Ethnicity data is not included in cancer stats, leading to assumptions being made about how patients will respond despite there being clear difference in how certain cancers affect different racial groups. We also had the report from Healthcare Inspectorate Wales showing clear evidence of Black, Asian and minority ethnic women being treated differently at the University Hospital of Wales. First Minister, it simply is not good enough. When can Wales BAME community expect to get equality in healthcare?
Well, I thank Altaf Hussain for those very important points. I want to assure him that the Welsh Government takes those points very seriously indeed. I thought the report on maternity services in Cardiff was a genuinely distressing report, and I'm sure it will have been distressing for many of those people who work in that service, who don't come in to work in the morning looking not to provide a service that is genuinely available to every woman who uses it. The Anti-Racism Wales Action Plan has a whole section in it devoted to healthcare. And that is because, as I said, the plan was produced by people who reported their own experiences of using that service and of working in it as well. There is a challenge for the health service, undoubtedly, in making sure both that the talents of people from BAME communities who work in the service are properly recognised, people are able to make the career progression that their abilities deserve, but also that the health service, in those thousands and thousands of contacts that it makes with the public every day, is attuned to the notion that treating everybody the same is not the same as tackling inequality. You have to be able to recognise the particular needs of different groups and respond to them in a way that shows that you recognise those particular needs and that the service is geared up to dealing with them. That's not a journey that is over by any means, but I don't think for a minute that it is a journey to which the health service and people who work in it are not committed. The reports of the Health Inspectorate, the action set out in the Anti-Racism Wales Action Plan, I think help us down that journey, and it's very good to have those points raised on the Senate floor this afternoon.